Hello again, my name is Dr. Amanda Notley-Kim. I'm a physical therapist with ProClinix Sports Physical Therapy, and this is Rovie Ferrara. And we're back again to show you some strengthening exercise for the knee as part of part 2 of our Web E-series. If you're here for part 1, we showed you knee stretching exercises that would help alleviate your pain. Now we're just following that up with some strengthening exercises. Okay, so I'm going to have Rovie lay on her back, and we're going to do an exercise called straight leg raise flexion, which will help strengthen your quad muscle. So what she's going to do, we're going to be working the left side. So she's going to bring her toes up towards her, which will help straighten out her leg. She's also going to squeeze her quad to keep that activated. And she's going to bend the opposite knee to help protect her back. The movement for this exercise is her lifting her leg up just to the height of the opposite knee and back down. And again, if anyone has back pain with this exercise or has back pain in general, I want you to keep your back flat and flush with the surface you're doing this exercise on. And also bending your knee helps offload any pain or tensions in your back as well. Now she's going to do 3 sets of 10. Again, you could take a break if you need to avoid any fatigue and loss of form, because we don't want to create any extra pain in other areas. Good. Okay, and the next exercise we're going to show is a bridge exercise. Rovie's going to keep her knees hip width apart, and she's going to make sure that they're all aligned with each other. So what she's going to do, the motion of this exercise is basically to lift her hips up. Good, basically so that her knees are in line with her shoulders. What you don't want to do is lift your hips up too far where it pinches your back and creates any tensions or pains in your back. So she's going to squeeze her glutes to drive her hips up, only to where it creates a straight line through from her knee to her shoulder. And she's going to hold that there for 5 seconds at the top, really squeezing her glutes, and she's going to do this 20 times. Perfect. Okay, and our next exercise are clamshells. So if you don't have resistance bands like we do in our clinic, what you can use at home, if you have access to ankle weights, you can put one on your thigh to help increase the pressure and weight, or you can increase your reps to make this a little harder. So I'm going to have this above her knees, and she's going to lay on her side that's not affected. So if you have pain on the left side should be on top. We're going to be working this side. And it's also important to note that the joints are laid on top of each other, so they're aligned correctly. So like her hip joint, her knees, and her ankles are both laying on top. And the movement of this exercise would be just opening her knees as far as she can go. But I do not want you opening up so far where you rock your body backwards, because then that makes you lose your forearm and create some tensions in different places. So just having your back straight and aligned is a perfect position. And if it means not opening so far, that's okay too, because that'll still activate the correct muscle, which is on the side of your hip here. Now she will be doing 3 sets of 10 as well. Again, taking breaks if you need to, because if you get tired, you tend to lose your form. So I'd rather have you take breaks and then continue on doing your reps. Good. Okay, the next exercise we're going to show are squats. I'm going to have Rovie demonstrate a squat. And what we're looking for here in the front view is basically that her knees do not cave in like so. We do not want you to do that because that puts increased pressure through the knees and can create any knee pain that you might have. And here we're using the chair to assess her depth so that she doesn't go down too far. So what she's doing is just tapping the chair with her butt, and at the end there she's going to squeeze her glutes to come up, and she's going to slowly lower down. Again, here you're pushing out your knees versus them caving in to prevent any increased pain in your knees. Perfect. And now we're going to show a side view. And so in this view, what we're particularly looking at is that the knees don't track too far past your toes like so. That can again put increased pressure through the kneecap and create some pain. So what we want to do, basically think like you're sitting down in a chair. That'll create less tension through your knees, and it'll have your weight more posteriorly, which means it'll shift your weight backwards so that it's not putting too much pressure through the kneecap. So when you're at home, just think of sitting in a chair. That'll automatically get you in the right position to do a squat. Again, you're just going down and squeezing your glutes as you come back up. Okay, and it's very important with squatting that you have the correct form that we went over, because again, we do a lot of squatting throughout our daily life that we don't even think about. Like when you bend over to pick something off the floor, make sure you're bending with your knees, not your back, so that you protect and don't create any increased pain. So these techniques are very crucial to help you avoid any pain in other joints of your body. If you sit down in a low sitting couch or chair, it's also good to keep that technique in mind, because again, you don't want to put increased pressure through your knees. So thank you again for joining us as a part of our WebE series. If you have any questions, you can leave the comments below in the comments section, or you can call up our administrative team and they can answer any questions you may have. Thanks again for joining us.